and bring you insight from the leading experts in the field. I'm your host, AB, and with us today, Dr. Clarissa and Dr. Aisyah. Okay. Thank you for joining us today in discussing in issue of fertility. Welcome, Dr. Aisyah and Dr. Clarissa.
Thank you for having us.
Okay, today's session will be an interesting topic that commonly happens in the household of each individual. It is related to ovulation and fertilization. The problem will affect the chance of having children. So today, we will discuss about it together with our specialists today. Now, let's dive into the topic. Today, we are honored to have Mrs. Aisyah and Mr. Haris in the line who are willing to share their fertility problem. Hi, Mrs. Aisyah and Mr. Haris. How are you?
Hi. We are fine.
Thank you for spending time with us. So you guys share your problem that you are facing due to your fertility problem?
Yes, sure, Miss Abby. I was experiencing erectile dysfunction. Erectile dysfunction, or we call it ED, is a type of penile disorder. It affects my ability to maintain an erection firm enough for sexual intercourse. I am experiencing ED because of my obesity. Other than that, my semen is normal, but the volume of sperm is low. This condition reduces the likelihood of sperm to fertilize an egg.
In my condition, I was experiencing an irregular period. For example, I only experience menstruation once in every 2 months. Sometimes the time range of my period is whether too short or too long. I am also undergoing a surgical procedure to remove one fallopian tube known as salpingectomy. This can affect my chances of conceiving because it reduces egg release pathway.
Thank you, Mrs. Aisyah and Mr. Haris, for sharing your problem. So now we will discuss your problem with our specialists, Dr. Aisyah and Dr. Clarissa. So earlier we heard the problem faced by Mr. Haris and also Mrs. Aisyah. So maybe Dr. Aisyah could explain the process that couple needed to successfully conceive.
Alright, thank you, Ms. Baby. First of all, ovulation and fertilization are very important for couples seeking to conceive. Regular ovulation is essential for maintaining hormonal balance and a consistent menstrual cycle. Okay, alright. Let me explain exactly what the mechanism of ovulation and fertilization is. Every month, a woman's body goes through menstrual cycle, with ovulation being most important part of it. Ovulation is the process by which immature egg is released from the ovary. Meanwhile, fertilization mechanism is the process by which male sperm cell successfully mate and penetrate the egg in the fallopian tube, producing a zygote that can be implemented in the uterus to initiate pregnancy.
Okay, thank you, Dr. Aisyah, for a very easy and simple explanation of the process, which is ovulation and fertilization. So based on the explanation, it is important for us to have knowledge about the mechanism of ovulation and fertilization to have chance of getting children. Now, viewers, let's watch the video prepared by Dr. Aisyah to see how this mechanism occurs more clearly.
Every month, your body's hormones tell your uterus to make a lining of blood and tissue. Also, once a month, your body will send a signal to begin ovulation. Ovulation is when a woman's ovaries release an egg. An egg is released about 14 days before the first day of a woman's period. The egg then travels down one of the fallopian tubes. When a couple has sexual intercourse and does not use birth control around the time of ovulation, a man's sperm will swim to meet the woman's egg. When a sperm penetrates the egg, it's called fertilization or conception. The fertilized egg or embryo then travels to the woman's uterus. Here, the embryo attaches itself into the lining of the uterus and begins to grow.
As we know, every problem will definitely have a strategy that can be done for us to face the problem. So I would like to ask Dr. Clarissa, what strategy that Mr. Haris and Mrs. Aisyah might be able to do due their fertility problem? And are there any medical advancement or treatment that may help them to conceive?
Certainly, Ms. Abby. There are several strategies that may help them to conceive. Two of the most prominent treatments are intrauterine insemination and in vitro fertilization. Intrauterine insemination involves placing the sperm directly into the uterus when the ovaries release egg, aiming to boost the chances of fertilization by increasing the number of sperm reaching the fallopian tube. This strategy is very useful in a condition
Like Mr. Harris, where the sperm count is low. Meanwhile, in vitro fertilization is a more complex process. It involves collecting the mature eggs from the ovaries, fertilizing it with sperm in a lab, and then transferring back the fertilized egg into the uterus. This strategy often recommended for female who has removed fallopian tubes.
Okay, thank you, Dr. Clarissa, for the two suggested strategies, which are intrauterine insemination (IUI) and in vitro fertilization (IVF). That may help all the couple out there as another effort or ways in having children. For a deeper explanation about IUI and IVF, let's watch a video prepared by Dr. Clarissa for better explanation.
I would like to emphasize the importance of maintaining overall health and well-being. Regular checkups with your doctor may help catch and manage any potential issues early on.
They're also crucial to lead a healthy lifestyle, like eating balanced diet, exercising regularly, managing stress, and also we need to avoiding harmful substances like tobacco and excessive alcohol.
Thank you so much for joining us today, Dr. Aisyah and Dr. Clarissa. Your expertise is invaluable, and I'm sure our viewers learned a lot today. And thank you for our viewers for tuning in. If you have any question or topic you'd like us to cover, feel free to reach out. And remember, understanding your reproductive health is key. Until next time, stay healthy and see you again. Bye-bye!